So I'm going to talk about dermaplaning. You might hear it also be called skin blading. During this process, we use a surgical knife to scrape the skin surface. It removes dead skin cells. In fact, it's 3 times as effective as microdermabrasion. During the process, it will also remove any downy, fluffy, peach fuzz type hair, vellus hair. It's an added bonus to the treatment. So I'm just going to wipe over the skin surface with an alcohol solution. Really important to make sure that the skin's degreased before applying the blade to the skin surface. Pretty much anybody can have this done. If you've got active acne or a large number of moles on the skin surface, it might be more difficult. We get lots of gents that come to have this treatment done. Sometimes they'll just have half a face. Really leaves the skin feeling nice and smooth. It looks fresh. And we can work anywhere all the way up to the jawline. The only place that we don't work is over the lips and over the eyelids. It's really important that you'll see the blade is at a certain angle, which is 45 degrees. And I'm working back and forth. Shouldn't feel uncomfortable at all for the client. If anything, it just feels like a slight etching sensation on the skin surface. We're looking for some dead skin cells to come off with the hairs, as you can see. This treatment takes around about 45 minutes depending on the client. You can have this treatment done once a month. Every 4 weeks, it's important to let the skin return back to its original state. One of the most frequently asked questions about dermaplaning is whether or not it stimulates hair growth. It doesn't. There is a very particular technique to the way that the blade is placed on the skin and the technique that's used. The hairs will come back, and they will come back at exactly the same thickness. It doesn't stimulate growth. So as you can see, the hairs are on the gauze pad at the side of the client's face. I haven't completed the treatment yet. I will work over the chin, the top lip, the nose, and in between the bridge of the eyes. But you can see the hairs that have been removed just here. Following the treatment, it's really important that the client wears SPF and bears in mind that any products that they put on the skin for the next 3 to 5 days will soak in the skin a lot more than before. So as you can see, the skin isn't left red, it isn't left dry. Over the next few days, the client might experience some dryness and some flaking. That's completely normal. The last piece of advice that I would give to my client is to leave her makeup off for the rest of the day, but after 24 to 48 hours, the client can just continue with her normal home care routine and regime.